Briefly, Igede General Hospital was established in 1983 to cater for a rural community, Igede, Egbin, and Ikongba. The first census, that was in 2006, gave that area a population of 1.6 million. But as of today, when I met the chairman of the local council development area, he said by now that area should be the population should be more than 2 million. I got there 2017, and as of that time, there hadn't been any major repair nor expansion. So you can imagine what I met on the ground. This was a hospital that was built in 1983 for maybe they were less than 1 million. And here I am, I'm supposed to use the same space for over 2 million people. So I want you to just think about the scenario. My predecessor, Dr. Amuri, had done a lot of work on mother and child, But my first week there shows a lot of gap between us and the populace. And the problem was from TBAs. I think the first week, about 3 pregnant women were brought in dead. And that's really, 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 really got me thinking. And so what did we do? I could easily pick up champions from my junior clinical staff. And so what I did was that, yes, I can see the baseline where we are today, but how can we move the hospital to the next level? So I told the junior ones, please go and discuss among yourselves, and we provide refreshment for them. So while they were relaxing, give us tips on how to carry this hospital to the next level. And then myself and the HODs, we went on round and we were seeing things, and why did I do this? I had this vision, immediately I got in there. But I want that vision not to be my own vision, but to be our vision, so that we own whatever we want to do, and that there will be total commitment to the cause. Because we say our vision is to be the choice hospital, the choice health facility in that environment and beyond. And the mission is to do what? To provide quality, affordable services in a serene and conducive environment, with our staff exhibiting good staff attitude. And so, after doing that, when we came back, we seemed to have the same, mission. We seem to have the same goals. So we merge, and so the vision becomes the vision of Igede Health Family Team. And so it was very easy for us to move ahead. So we started with engaging the community elders. We engaged the TBAs. We let them know where the type of patient they can take. We let them know their limits. They are not supposed to take patients with comorbidities. Even when they're not supposed to take Pramib, and they're not to take patients that are doing well initially, but now have complications along the line. We have to train them, because whether you like it or not, they see more patients than we do. The gap is as a result of cultural belief, religious belief, poverty, and Igede is a coastal terrain, so there is poor road network. And one of the things we did was to actually put all our ANC on a WhatsApp platform, and we dedicated some staff so we can connect with them every moment of the day. Not only that, we render ambulance services to our TBAs, because one of the reasons why they brought in pregnant women dead was that they did not have any facility, any vehicle to convey. So we gave them our numbers, and then we call us and we go there to bring the patient at the right time. Not only that, we had to work on ourselves. Luckily, Lagos State has so many opportunities for us to leverage in the strategic policies from Ministry of Health. The first thing that comes to my mind is the health reform of 2006. The functions of every cadre, every member of health team in Lagos State is clearly spelled out. And Lagos State Ministry of Health now happens to be the supervisor. And then there's something I like there, the community engagement. Making sure that the community owns that hospital. The community that are part of the governing board of the hospital actually feel the pulse of the populace. So when they come for meeting every other month, we are able to feel whether we are doing well or not. And this has really helped us. And now we have even extended to the youth. Because the youth of that area, they are very restless. And so about a week ago, they called and said, I should come for an award. I don't like any award. But because I want to be close to those youth, I went there. And when they give me that award, and I told them, this award will be meaningful only if you as the youth come and be owners of that hospital, because that hospital belongs to you. We are just custodians. And one day will come that we are going to move over. But that hospital remains yours. And they have promised to look at the restfulness of the youth for us. Another thing is that we had to work. I believe that leaders should come from their high top and come down to the level of their staff. A good leader must be a good motivator. You must be close to your staff. You must feel them. You must mentor them. And you must lead by example. And in Lagos State, we have service charter, the 5 pillars, which are good service delivery, punctuality, that's timeliness, that is, your patient must get your quality care very timely. They must not be kept waiting. And we have your information. That information to your patient must be passed, in the right language that the patient can understand. Not only that, we have staff attitude. And I think that is there where you have the most problem. And how do we address this? I must say that the first 6 months I spent in Igede, I happened to be a storyteller, telling them evidence-based stories. Evidence-based stories. And you know what? When they listen, that sinks more into them. And I've been able to, they've bought into that vision. I always tell them, see yourself in your patient. Whenever a patient comes to you, ask yourself, if that was me, how would I like to be treated? And that they can never get it wrong. And you know what? A good leader must aspire to make a champion of every staff in that hospital. Don't condemn anybody. Some of them, when they see that some people are doing well, they too, and then you start doling out motivation to them. You send them for courses. You build their capacity. They fall in line. There could be maybe it's just 10% of people, but don't give up. Keep on doing what it is right. And what else that we leverage on is innovation and creativity. And with it, they bring growth mindset. Gone are the days when the CEO will say, yes, I want it to be done. Yes, this thing must be done this way. No, I don't like that. You call them together. And I have found the junior ones to be most innovative. I will say that it was one of our domestic, we don't call them cleaners, we call them beautifiers. It's one of them that one day we were having family meeting and she got up and she said, MD, please, tell the procurement that we need right things to work, right tools, so that we can excel. And that very day, I asked the procurement, are you sure you don't carry end users around along when you are buying things? They say, no. I said, as from today, that must stop. And since then, if I didn't listen, a good leader must be a good listener. If I did not give them the chance to express their mind, we are so close now that even when I'm going around, you will not see all those paraphernalia of anything. They are welcome at any time. Another thing that the opportunities is that, I don't have to pay my staff salary, so that's a big load of my, I don't think of salary, I don't think of how to, fund my capital project. That I don't think of how I'm going to train and retrain, And another thing is that we have good monitoring agency. I'm sure Dr. Alabi will tell you more about that later on. Monitoring agency, they keep us on our toes. And my performance is tied to my facility outcome. Regularly, our scorecards are displayed, and you don't want to go for such events and your hospital is low down there. So we keep on striving and striving and striving to make it work. Are there any challenges along the way? Yes, we have challenges. The first one is the one that I've told you about, that is lack of staff engagement, and that has been taken care of. But the challenges that are really, 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 really of concern is those risks because of our success. Now we have to more work with the same number of staff. So I need to boost the morale of my staff. Not only that, acute space shortage. So we have to create a marquee, like an event center. Anybody that enter the hospital, they will say, so you do it. This is an event center. I said, no, let's go inside. There we have 7 consulting rooms, and that place houses our OPD. Very comfortable environment. And it has reduced our patient waiting time to 15 minutes. And that is, the turnover is so high. Thank you. And these people, because of the satisfaction, we also have the way we measure our patient satisfaction. I have one that immediately I come in the morning, I have some boxes, one for happy people, one for people, and we have balls. And when I come in, I just look at the box that is a small ball. And I have dedicated service chartered angels. These are beautiful ladies, well-dressed. They welcome our clients, and then they show them. And where they are going, if anybody drop into the sad box, they quickly say, well, please, can we know why you are not happy with us? We want to know so that next time you come, you can have a better experience. And some of them that can write with free form, they leave their phone number. And I have a very articulated complaint resolution officer. And within 24 minutes, that complaint is resolved. And some of them will come and say, thank you very much. Today, I have a better experience. So we've been striving to achieve patient satisfaction. The last time we did the survey, this last quarter, third quarter, our general patient satisfaction for outpatients is 95%. And we want to even take it to a greater level. For our inpatient, our total satisfaction is 89%, and we are working to exceed that in our last quarter this year. So another thing that we want to know is that what I want to let you know is that quality healthcare is doable, is achievable. When they say WHO checklist, I said, WHO does not, they don't own checklist. As far back as 90s, as an anesthetist, we always have checklists before you do your checklist. So we've always had that with us. So WHO to me does not own checklist. If you have passion for what you are doing, you must check before you do anything. So, and that is what we have been doing in Igede General Hospital. So, what are the necessary ingredients? I'm happy I'm in Lagos State, because Lagos State has given all MDs about 50% to succeed. So the 50% is you. And so if you have good policy, whether you are private or public, and I want you to know this, that our health facility monitoring agency, don't say because they come to private alone. No. They don't even they are harder on us. They won't, we have a big volume like this, and they will just come unannounced. And there are other things, MPDSR, and this MPDSR, now we've been asked to collaborate. You know, the 5 pillars of our new governor, His Excellency, Mr. Babajide Sanwo-Olu, is themes. And the HDI is for health and environment. And we have keyed into it. So we are moving Lagos to a greater level because a healthy state will be more productive. And so it's doable. Just have a policy statement, full implementation of that statement at all levels, and you must have an agency that monitors. And not just monitor, not just we are coming to see you today. No. Do it Lagos State style. So we have been able to raise our revenue from 95 when I got there to 250 million. We have been able to raise our delivery, and that's our patient satisfaction survey. That's for outpatients. Yes. The downside is just this year up to September level. So we have not reached the end of the year yet. And I'm sure by the end of the year, we are going to move up again. So, and I want to appreciate those people that have mentored me. And the greatest of them is Dr. Mrs. Ogusholure. She, the past permanent secretary of HSC, she taught us what quality is all about, even when I was very young. And another one is our former commissioner for health, Dr. Igede Idris. He is a great health reformer. He was the one that caused the tsunami of quality health to blow over health facility in Lagos State. So in each facility, quality healthcare is enshrined in the facility. And so you cannot see any facility today in Lagos State that is sloppiness. And now we are even collaborating with primary health center to make sure that we get good outcome in that domain. Thank you very much. I hope I've been able to just whet your appetite and to encourage you wherever you be that quality healthcare is doable. And what I want us to be thinking about now, when we talk of quality, we are talking of patient-centered care, patient-centered care, patient. Now, I want to know that we should go a step further and think of the health givers. Because sometimes the health givers are abused. So how do we protect their rights? We protect their rights in a way that quality health care will not be compromised. Because am I allowed to say, no, you've been so violent, I cannot see you. Can you please see my colleague? Is that right? Because I've had to deal with cases of staff abuse. A patient so violent will slap his staff, and when you complain, they will say, quality health care is patient-centered care. Agreed. I think we have to look after ourselves. Thank you very much.